Good afternoon, everyone. Welcome to our 10th episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you all for joining us today. My name is Kaylin Harris.
And I'm Sherry Gibbs, your co-host for today's special edition of Wellness Wednesday. Our goal for Wellness Wednesday is to introduce you to our many experts at Nashville General Hospital, have them share information that's vital for your health and wellness, and give viewers an opportunity to ask questions. June is Men's Health Month, which is why we've asked Dr. Douglas Altenbern, to be our Wellness Wednesday guest presenter.
Dr. Douglas Altenbern is a urology specialist in Nashville, Tennessee, and has been practicing for 28 years. He graduated from Vanderbilt University School of Medicine in 1968 and specializes in urology. Today, he will be presenting on men's health and the importance of annual screenings. Without further ado, please welcome Dr. Douglas Altenbern.
Thanks, Sherry and Kaylin. I appreciate it. Actually, I graduated in 1986, not 1968. So I'm not quite that old yet. I'm glad to have this opportunity to talk about Men's Health Month. And I will try to get our presentation going here. And there we go. So this is Men's Health Month, and we're trying to create education and awareness opportunities during the month of June. This is the last day of Men's Health Month. And so June is set aside each year for that. A couple of other awareness months that are important to men include Testicular Cancer Awareness Month, and that's in April. And in September is Prostate Cancer Awareness Month. Current state of men's health, not as good as women. Men are half as likely to see a healthcare provider as women. They're more likely to be uninsured and therefore may not feel like they have access to medical help. Men also tend to die at higher rates than women for 9 of the top 10 causes of death. And you see these here. Most of these look familiar. But Alzheimer's disease is the only one of these causes of death that is more likely in women than in men. Cardiovascular disease, it's a leading killer of men and women in all ethnic groups across the board. But about 1 in 3 adult men have some type of cardiovascular disease. Also important, men suffering from cardiovascular disease are more likely to have erectile dysfunction. Diabetes can affect men. About 12 million are affected. It's a leading cause of many problems, including heart disease, strokes, kidney failure, blindness, and amputations. Also, a man suffering from diabetes may also have erectile dysfunction as a symptom. There are over 300,000 cancer-related deaths in men each year. Prostate cancer is the most common cancer, but lung cancer is the one that is more likely to cause fatalities in men. 3 important issues in prostate health. One of them is BPH, benign prostatic hyperplasia, which just is enlargement of the prostate with age. This can cause frequent urination with a weak stream, difficulty urinating, or a feeling of incomplete emptying of the bladder. This does affect about half of men over age 50, but as men get older, more and more men are affected. Prostate cancer, another big issue in prostate health. Again, it's the most common cancer in American men. About 1 in 7 men born today will be diagnosed in their lifetime, but many more actually probably have the disease and won't even get diagnosed. African American men are at increased risk. Prostatitis is the third issue that men may face with their prostate health. It's an inflammation of the prostate that can be caused by infection, but important to note that this can affect younger men even in their late teens, all the way up to men in their 90s. Testicular cancer, not as common as prostate cancer, but this one does tend to affect younger males from late teens into their 20s and 30s. There can be risk factors of undescended testicle and family history of testicular cancer. White men here are the most likely men to get testicular cancer over Hispanic, Asian, or African American men. Sexual health can be important to men and often is a reflection of health in general. So the healthier you are, usually the better the erections. But erectile dysfunction, as we know, is associated with vascular disease, diabetes, certain medications such as antihypertensives, smoking, or other problems. And about 30 million American men do have issues with erectile dysfunction. Mental health can be an issue for men. It's defined as a psychological well-being and satisfactory adjustment to society and to the ordinary demands of life. So stress, anxiety, and depression can be issues that affect mental health. Why don't men go to the doctor? They tend to say they're too busy, they have work obligations. A lot of men, if they don't have health insurance, just will skip it altogether. And then some men with health problems tend to just hope that they'll get better with time. But the biggest obstacle, men just don't tend to make health their top priority. So what do we do for prevention? Get an annual health exam. Know your numbers, PSA, cholesterol, glucose level, and blood pressure. Ask your doctor's questions. It is your body after all. And start early. People should start in their young adult years to get a regular office visit with a doctor. Don't wait until you're older. Also, take advantage of free community health screenings, or if your employer offers services, take advantage of those, and be a role model for your children. Diet and nutrition. Over 60% of American men are overweight or obese, especially men between 65 and 75 have the highest prevalence of obesity. Americans do spend $30 billion a year on diet programs. The only effective way to lose weight is reduce calories and get some exercise. Eat a diet rich in fruits, vegetables, whole grains, and low-fat dairy products. Good sources of protein include lean meats, poultry, fish, beans, eggs, and nuts. We also need to limit our intake of saturated fat, trans fat, cholesterol, salt, and sugar. Exercise and fitness is important. If you're completely out of shape, you might have to start slow, maybe 5 minutes a day. But eventually we want to get up to 30 minutes a day of moderately intense cardio 5 days a week, or mix it up with resistance or weight training a couple of days a week and then cardio a couple of days a week. But any activity is better than no activity. Cardiovascular disease, what can we do here? Get regular physicals, lose weight and choose a healthier lifestyle, regular exercise, limiting alcohol and caffeine, reducing stress, and quitting smoking. Diabetes, it can be prevented. Keys are keeping a healthy weight, getting exercise, and eating a healthy, sensible, balanced diet. Cancer, risk factors, we all know smoking is a risk factor, but cancer can run in families, does tend to affect older men or people that have had cancer of some type in the past, may be at higher risk for other cancers. But prevention would include regular checkups, notifying your doctor if anything seems abnormal, taking part in screening for prostate cancer, getting colonoscopies to screen for colon cancer, but reducing risk by avoiding tobacco, staying active, and sun protection can help in prevention of skin cancer. Men can cope with stress and anxiety by regular exercise, eating healthy food, avoiding self-medication, getting rest, and having some fun. So it looks like there's a trend here to keep men healthier and happier. See a doctor, eat a healthy diet, get regular exercise, maintain a healthy weight, get some sleep, and manage your stress. That's all I've got for a presentation. If there are any questions, I'd be happy to field some questions.
Well, thank you, Dr. Altenbern, for providing such important information this afternoon. So we are still waiting on a few questions coming in the chat, but we do have a few for you, or I have a few questions. So you did speak in your presentation about the psychological pressures that a lot of men go through when it comes to having this conversation about screenings and their bodies. So do you have any recommendations for how do you have that conversation with a family member or a loved one?
Well, I think men just need to swallow their pride and talk about it. And that first step may be going ahead and seeing a doctor to get screened, have their health screened. I think that's the first place to start.
Okay, perfect. Thank you.
Talk about screenings. At what age should men start getting screened?
Well, if you're talking about prostate cancer, I think
Both prostate cancer and then overall general health.
Yeah, overall general health, I think, a young man should get a baseline physical with a doctor and have a relationship with an internal medicine or family practice doctor that they can turn to when they get sick. And then however often that doctor would recommend routine screening. But for certain men's issues like prostate cancer, we would recommend screening starting age 50. But for African-American men or men with a family history, they really should start at age 40. Young men can do testicular self-exams to help detect testicular cancer. So if young men would examine themselves at least once every 3 months, what they're looking for would be a hard lump in the testicle. Usually it's painless, but a hard lump like a chunk of gravel in the testicle.
So then, okay, so are there any health screenings that a man can complete safely at home, or would you recommend that they regularly see a provider or have like a primary care provider that they regularly see that they complete those screenings with?
Yeah, probably getting a primary care provider, although the testicular exam is something that men can do themselves at home. And if something doesn't seem right to them, then they need to go see the doctor.
How do testosterone levels change as men age, and how does it generally affect them?
Well, men, their testosterone levels will go down slowly with time over the years, and it's more of a gradual descent, unlike women where it can be very rapid over a period of just a year or two. So it can affect them by causing fatigue, sex drive. Some men may notice an increase in weight or a shift in weight where they're getting more body fat and they have less muscle mass. And even some men may report lack of concentration or ability to focus on work.
Okay, thank you.
These are some really great questions. So are there any common things that you see? I know because of HIPAA, there are certain things that we cannot discuss, especially on the live stream, on the
Right.
social media platform. But are there any common things or common factors that you see amongst like a certain demographic that you treat, or just, when it comes to like certain ages, if we had to cap off this Wellness Wednesday by saying, this is my biggest piece of advice, please make sure you do X, Y, and Z.
Well, in my practice, I just see adults only, but I do see quite a few younger men with all sorts of problems related to men's only issues with testicular problems, prostatitis. They may have some urinary problems as well. And occasionally we even get some young men with erectile dysfunction, although they get it for different reasons than older men. But main recommendation I can make for men in general is don't wait to get that first checkup with a primary care provider, and have one that knows you and that you can get in contact with when something comes up. Because I do see a lot of men that they come and see me, but they've never seen a primary care provider. You know, they're at a loss when they need somebody quickly. Having that relationship, I think, is good.
Definitely.
I know this is Men's Health Month, but I do have a question for the ladies.
Okay.
Because I think it's important to be sure that people know that women can also go see and do often see a urologist. So
Right.
for what diagnoses or preventative measures would a woman come to make an appointment with a urologist?
Well, a lot of our female patients may have issues with recurrent urinary tract infections. So we do see that a lot in women, and having problems with bladder control. So incontinence is an issue with a lot of women. But then women may get some of the same problems as men, like kidney stones or certain cancers of the urinary tract, like kidney cancer or bladder cancer.
Thank you.
Thank you.
Sure.
Thank you. Well, I think that is all the time that we have for today. Thank you again, Dr. Altenbern, for the informative presentation on men's health. And to all of our viewers, thank you very much for joining in. If you have any additional questions or you need to see a urologist, please call 615-341-4429 to schedule an appointment with Dr. Altenbern, or you can visit our website at nashvillegeneral.org. Once again, that number is 615-341-4429 to schedule an appointment.
Thank you so much, Kaylin, for hosting, and Dr. Altenbern for this great information. Thanks also for everyone who joined us today. Like and follow the Nashville General Hospital Facebook page to be notified about upcoming Wellness Wednesday segments, and have a safe and healthy holiday. Thank you.
Thank
Bye,
you.
everyone.